Welcome to Marshfield Clinic, and thank you for taking the time to watch this video to learn about your upcoming shoulder replacement. Annually, over 53,000 people undergo shoulder joint replacement surgery. There are several reasons why your doctor may recommend this procedure. For example, you may have severe shoulder pain that interferes with everyday activities, such as reaching into a cabinet, dressing, toileting, and washing. You may have moderate to severe pain while resting, often severe enough to prevent a good night's sleep, loss of motion and/or weakness in your shoulder, failure to substantially improve with other treatments such as anti-inflammatory medications, cortisone injections, or physical therapy. If surgery has been recommended to help relieve your pain, we want you to understand the procedure in more detail. Marshfield Clinic wants you to know what the alternatives are and what options you may have. There are non-surgical alternatives that should be tried prior to surgery, such as medications, Tylenol and or non-steroidal anti-inflammatory medications like ibuprofen and naproxen, activity modification or other non-operative measures such as physical therapy or injections into the shoulder. As with any surgery, shoulder replacement has risks and complications. We want you to understand these risks. They include infection at the incision site, rotator cuff damage, bone fracture, dislocation, loosening or implant wear, damage to nearby nerves, blood vessels, or tissues, healing difficulties, and infection of the bone around the implant requiring surgery to fix. Shoulder replacement surgery was first performed in the 1950s to treat severe shoulder fractures. Over the years, shoulder joint replacement has come to be used for many other painful conditions of the shoulder, such as different forms of arthritis. Joint replacement surgery is a safe and effective procedure to relieve pain and help you resume everyday activities. Many thousands of patients have experienced an improved quality of life after shoulder joint replacement surgery. They experience less pain, improved motion and strength, and better function. The success of your surgery will depend largely on how well you follow your orthopedic surgeon's instructions at home during the first few weeks after surgery. Generally, patients are able to return to driving in 2 to 4 weeks. Consulting with your surgeon and physical therapist for particular activities is the best way to determine an activity level suited to you. Your care team includes physicians, anesthesiologists, physician assistants, patient care technicians, medical assistants, nurses, discharge planners, pharmacists, and physical and occupational therapists specializing in total joint care. Every detail, from preoperative teaching to postoperative exercising, is considered and reviewed with you. The Joint Care Coordinator will plan your treatment program and guide you through it. You must register for a joint replacement class that's offered at your place of surgery, and you're encouraged to bring a family member or friend along as your coach. The information you'll obtain is invaluable. You must stop smoking before surgery. Smoking impairs your oxygen supply, which is important to your healing joint, and it increases the chance of infection and complications. Current smokers have an increased risk of wound complications following arthroplasty. Studies reveal that current smokers had approximately twice the rate of deep wound infection compared with former smokers or non-smokers. If you need assistance quitting, please talk with your primary care provider. The Wisconsin Quit Line is a great resource that's available 7 a.m. to 11 p.m. 7 days a week. The Quit Line is free and confidential. 1-800-QUIT-NOW. Obesity has a negative influence on the outcome after surgery. If you have a body mass index score of 40 or greater, you'll receive or be offered a clinical nutrition consult. Patients who are obese have more wound infections and a higher revision rate compared with patients at a normal weight. This rate becomes substantially higher at a BMI greater than 40 and can result in early failure of your total joint from poor wound healing or infection. Increased risks are associated in both the short-term and long-term. Other complications that are increased are stiffness requiring manipulation under anesthesia, systemic complications including blood clots, heart attack, respiratory failure, stroke, pneumonia, urinary tract infection, and blood transfusions. You should make every effort to increase activity and lose weight before surgery. Some surgeons may not do your surgery if your weight becomes too high, making surgery too difficult and high risk. Glucose management is extremely important in your healing. If you are diabetic with poor glycemic control, you have an increased risk of surgical site infections and revision rates. Good glycemic control before and after surgery is necessary to minimize complications and promote healing. Your hemoglobin, A1C, will be reviewed prior to surgery, and your medications will be reviewed and adjusted if necessary to lessen this risk. Tell your surgeon about all of the medications you take, including herbs, supplements, and over-the-counter medications. Some medications can cause bleeding, and your surgeon needs to know that ahead of time. Once the decision has been made by you and your surgeon for joint surgery, you'll be contacted by the joint coordinator. They'll act as a liaison between the doctor's office, the place of surgery, and the testing facilities. The surgeons will also monitor your outcomes, and this process will be further explained to you at that time. The joint care coordinator will be responsible for your care needs from the preoperative course through discharge and postoperative discharge follow-up. He or she will explain the patient clinical team agreement that you and the surgeon will be asked to sign that reviews your partnership with your care team and your commitment to the recovery program. They will assist you with your needs as well as coordinate your discharge plan to outpatient services, home, or to a subacute facility. You should contact your insurance company to find out if pre-authorization, pre-certification, a second opinion, or referral form is required. If you don't have insurance, please notify the registration staff when they call you for pre-registration. Tell them you'll need help in making payment arrangements. After your surgery has been scheduled, you'll be asked to pre-register at the location of your surgery. Please have with you your Social Security number, insurance cards, emergency contacts, advance directives, driver's license or photo ID, and any co-payment required by the insurance company. You'll need to obtain medical clearance from your primary care physician or another specialist in addition to seeing your surgeon pre-operatively. You'll need a few laboratory tests based on your individual health history prior to surgery. We'll be checking for any anemia present pre-op to allow for adequate time for treatment prior to surgery. All patients are screened with a nasal swab for methicillin-resistant Staphylococcus aureus, or MRSA. If this test comes back positive, decolonization treatment will begin prior to surgery to eliminate the bacteria. Before surgery, we'll review your medication and medical history with your anesthesia doctor. The anesthesiologist will discuss options for anesthesia. Regional anesthesia is used to reduce your risk of complications. Many patients with arthritis favor their joints and thus the joints become weaker, which interferes with their recovery. It's important that you begin an exercise program before surgery. Your physical therapist can provide you with some basic range of motion and strengthening exercises to guide you in your preparation for surgery. Medications that increase bleeding, such as anti-inflammatory medications and blood thinners, will need to be stopped prior to surgery. Your primary physician or joint coordinator will review your medications and give you specific instructions for stopping these medications. Have your house ready for your arrival back home. Clean, do the laundry, and put it away. Put clean linens on the bed. Prepare meals and freeze them in single-serving containers. Cut the grass, tend to the garden, and finish any other yard work. Pick up throw rugs and tack down loose carpeting. Remove electrical cords and other obstructions from walkways. Install nightlights in the bathrooms, bedrooms, and hallways. Pick up any assistive devices such as grab bars, walker, raised toilet seat, etc. that will assist you in your recovery. Go through your home and place any items you may need afterwards on low shelves. Arrange to have someone collect your mail and take care of your pets or loved ones if necessary. Plan ahead now and you'll have less to worry about during recovery. Patients are able and will do better at home for recovery if they go home as soon as they are safe with ambulation by themselves. You should be as active as you can as soon as you can to prevent complications from inactivity like blood clots. Also, you'll sleep better at home in a quiet, familiar surrounding, which helps with maintaining strength for recovery. And finally, the risk for infection is lowest at home. Surgical site infection is a serious complication of surgery, and is usually associated with increased length of stay for the patient, and also higher hospital costs. You'll be asked to shower the night before the day of surgery and use a special skin cleanser. This special cleanser will reduce the amount of germs on your skin. Specific instructions will be provided by your joint coordinator. Your joint coordinator will provide you a time that you need to arrive at the facility. You'll be asked to come in 2 hours before your scheduled surgery to give the nursing staff and anesthesiologist sufficient time to start IVs, prep, and answer questions. It's very important that you arrive on time to prevent your surgery case from being moved to a later time. The night before surgery, don't eat anything after midnight, including even chewing gum or a lozenge. You may have cleared liquids for a few more hours. Specific instructions will be provided to you by your joint coordinator based on your time of surgery. Items you should bring with you are personal hygiene items such as your toothbrush, deodorant, a watch or wind-up clock, shorts, tops, well-fitting slippers, and flat shoes or tennis shoes. Don't bring any electrical items. If you use a nighttime breathing device at home, bring only the mask. Also, bring along a copy of your advance directives, insurance cards, and photo ID. Please leave any jewelry, valuables, and large amounts of money at home. On the day of surgery, you'll be prepared in the outpatient surgery area. This includes starting an IV, meeting your anesthesiologist, meeting the surgical nurses, and seeing your surgeon as he or she marks your operative site. Following surgery, you'll be taken to the post-anesthesia care unit, where you'll remain for 1 to 2 hours. During this time, your pain control will be maintained, your vital signs will be monitored, and x-rays may be taken of your new joint. You'll be asked to rate your pain on a pain scale from 0 to 10, with 0 being no pain and 10 being severe pain. This will assist the care team in addressing and monitoring your pain management needs. You'll have sequential compression sleeves or venous foot pumps applied to help prevent blood clots from forming. You'll then be transferred to your room, where your care team will assist with your recovery. You will gradually resume some of your daily activities, such as getting dressed, eating, and getting in and out of a bed or a chair. If you had a drain inserted in your incision site, this will most likely be removed by the end of this day. You will also be given written instructions upon your discharge. These exercises are fairly simple and require only a short amount of time. A successful outcome to your shoulder joint replacement depends heavily on the meticulous performance of your exercises. Through the structured progressive exercise program, your muscles will be methodically and progressively stretched and strengthened over 1 year's time. The desired effect is the optimal function of your new shoulder. Your individual discharge instructions will be reviewed with you. If you are going directly home, you will need someone to drive you home. If you are going to a subacute rehab facility, your joint coordinator can assist with this planning early in your discharge. Initially after surgery, it may be more difficult to perform the activities you need to do during the day. It's important for you to do as much as you can for yourself. Performing these everyday tasks yourself will not only speed your recovery, they'll minimize the stress placed on other members of your household. Whether you're recovering at home or in a rehab facility, you need to protect your new shoulder. You will be wearing a sling for the first few weeks after surgery. The sling will aid in supporting and protecting your shoulder. A careful, well-planned rehab program is critical to the success of a shoulder replacement, with the goal to strengthen and improve your shoulder flexibility. It is very important for you to see your surgeon for scheduled post-op visits to ensure that your shoulder is healing well. At home, your main goal is to control your discomfort. Remember to take your pain medicine at least 30 minutes before physical therapy. Gradually wean yourself from prescription pain medication to a non-prescription pain reliever. You may take up to 2 extra-strength acetaminophen in place of your prescription medication up to 4 times per day. The success of your surgery will depend largely on how well you follow your orthopedic surgeon's instructions at home during the first few weeks after surgery. Here are some common do's and don'ts for when you return home. Don't use the arm to push yourself up in bed or from a chair because this requires forceful contraction of your muscles. Follow the program of home exercises prescribed for you. You may need to do the exercises 2 to 3 times a day for a month or more. Don't overdo it. If your shoulder pain was severe before the surgery, the experience of pain-free motion may lull you into thinking that you can do more than is prescribed. Early overuse of the shoulder may result in severe limitations in motion. Don't lift anything heavier than a glass of water for the first 2 to 4 weeks after surgery. Ask for assistance. Your physician may be able to recommend an agency or facility if you don't have home support. Don't participate in contact sports or do any repetitive heavy lifting after your shoulder replacement. Avoid placing your arm in any extreme position, such as straight out to the side or behind your body for the first 6 weeks after surgery. Your appetite may be poor and take a bit to return. Drink plenty of fluids to keep from getting dehydrated. You may have difficulty sleeping, which is normal. Don't sleep or nap too much during the day. Your energy level will be decreased for at least the first month. Pain medications, surgery, and a decrease in your activity may cause constipation. You should, however, continue to take your pain medication, even if you might be constipated. Some suggestions to help prevent constipation include adding fiber to your diet, use of stool softeners or laxatives, increase your walking, increase the amount of liquid that you drink. You'll receive specific discharge instructions regarding the dressing that was used for your surgery. It's normal for your incision to have some occasional drainage until it's healed. Notify your surgeon or care team if there is excessive drainage, redness, pain, odor, or heat around the incision. Take your temperature if you feel warm or sick. Call your surgeon if it exceeds 101 degrees Fahrenheit. Refrain from using a bathtub, hot tub, jacuzzi, or swimming pool for 6 to 8 weeks following surgery. Infection is a very serious complication following surgery. Bacteria can travel from anywhere in your body through your bloodstream and settle in the area of your new joint. Infection may cause problems including loosening of the joint and the need for revision of the joint replacement. Signs of infection include increased swelling and redness of the surgical area, change in color, amount and odor of drainage, increased pain in the area of your surgery with activity and rest, fever greater than 101 degrees Fahrenheit, bladder problems such as frequent need to urinate, pain or burning when urinating, sinus problems such as facial pain, pressure, congestion, yellowish-green nasal discharge, boils, burns or abscess on skin, dental pain, drainage or abscess. Take precautions to avoid infection. Call your healthcare provider if any signs of potential infections occur. Take proper care of your dressing. Take prophylactic antibiotics when having dental work or other potentially contaminating procedures. The orthopedic surgeons at the Marshfield Clinic advise you to be on lifetime prophylaxis for any invasive procedures. The joint coordinator will provide special instructions that will advise you what invasive procedures this applies to and how to obtain the antibiotic when needed. Notify your physician and dentist that you have a joint replacement. Please don't have any elective dental work for 3 months after your surgery. Therapy is a very important aspect of your ability to obtain the best results from your surgery. Your active involvement will aid you in achieving optimal functionality. Work closely with your therapist in order to achieve the maximum results as quickly as possible. There will be routine follow-up visits with your orthopedic surgeon. It's important that your progress be monitored to avoid any avoidable complications. The orthopedic surgeon will also ask that you participate in a survey that will be provided at periodic intervals to monitor ongoing success with the joint. This type of survey is called a Patient Reportable Outcome Questionnaire. This information will assist your care team in monitoring the success of your joint program and make modifications when needed. Remember, joint replacement is a big surgery resulting in a change for your body, and it can take up to a full year to adapt and recover completely from any surgery. The more prepared you are for your surgery, the smoother your recovery is likely to be. Follow all instructions from your surgeon. Be sure you have support at home. Be sure to get answers to any questions you have before surgery. Through the Security Health Plan shared decision-making process, they communicate that 90% are happy with their surgery while 10% aren't. The 10% report it is better than before, but not wonderfully happy with the outcome. There are many questions that will arise during your journey through joint replacement. Don't hesitate to contact your joint coordinator at any time to ask questions.